profits out of agricultural crime. People who reap what our farmers sow. And we will revive state support in the areas of marketing and distribution, including having clean markets with suitable facilities so that vendors and customers can conduct their business in dignity. Mr. Speaker, we will facilitate the deepening of linkages between farmers and other sectors in the economy, especially hotels and restaurants, with the aim of significantly increasing the volume of locally produced foods that our hotels purchase. We started it, and we intend to take it to another level. Yes, sir. Mr. Speaker, the medical and therapeutic Ganja industry is crying out for regulatory reform. We will overhaul the current system of regulation, which has allowed to stymie the progress of the industry in the last 9 years. And we will ensure the inclusion of small farmers in the industry by reducing the barriers to entry and encouraging linkages with well-capitalized processors. And we will also facilitate home-based production of ganja, integrating with licensed processors, and that is a major change. Mr. Speaker, at the end of the day, there are, I think, 262,000 registered farmers in Jamaica, and 80% of economic activity in rural Jamaica is directly linked to agriculture. We are making our farmers a priority in the next PNP government. Farmers, hold on. Help is on the way. A better life is ahead for the Jamaican farmer. Mr. Speaker, I turn to health care. Jamaica's public health system has reached a critical breaking point. As well as overcrowded and deteriorating facilities. Most recently, we're hearing about mold, which has locked down all 4 operating theatres in the Kingston Public Hospital. If you can't have operation in public, what does that mean? Member for Central St. Mary who knows about these things, it is a terrible situation. The current administration's focus on public relations over effective service delivery has led to a near collapse in the public health sector. It is heartbreaking to watch the news or scroll through social media knowing that every week there's another grieving family crying out for change. Mr. Speaker, the debacle of Cornwall Regional Hospital's renovation, which after 7 years has seen its budget explode from 2 billion to over 21 billion and counting, and still nowhere near completion, is a testament to the shambolic project execution of this government. And Mr. Speaker, it is an absolute travesty that no one has been held accountable for the mother of all overruns. It is an unmitigated disgrace. Mr. Speaker, the PNP will undertake a major policy shift in the area of health, from a focus on mega infrastructure projects towards enhancing the delivery of health care across Jamaica's clinics and hospitals. Patients go to a hospital or a clinic to be diagnosed and treated, to return home alive and well. Jamaicans are crying out for this lack of basic services. They want it to be fixed, and the next PNP government will fix it. The health system needs to pivot away from primary care. We need to pivot away from secondary care to primary care and focus on extensive screening. 70% of colon cancers in Jamaica are now diagnosed at advanced stages. 70% of colon cancers diagnosed at advanced stages. 90% of breast cancers are detected by a lump over a year after the cancer started. 90%. Prostate cancer is primarily diagnosed after it has already spread. 50% of diabetics and 40% of hypertensive patients have no idea that they have those diseases. And tragically, the entirely preventable cervical cancer, cancer of the cervix in women, continues to claim so many lives of Jamaica's women. We will launch a national screening program to identify the diseases that are the top killers of Jamaicans and treat them early and more effectively. No, your numbers are joke. Joking that. Prevention and early treatment are easier, cheaper, and more effective than late cures. They specialize in gimmicks. We specialize in real solutions to bring lasting change. Treating high blood pressure and diabetes effectively in our clinics will decrease the number of strokes, heart attacks, amputations, and kidney failures that are now overburdening hospitals, burdening livelihoods, and claiming lives. Mr. Speaker, despite of the grand announcements about the rehabilitation of health facilities, multiple operating theatres remain non-functional today at major institutions, including, as I've said, KPH, Cornwall Regional Hospital, St. Anne's Bay, Annotto Bay, and National Chest Hospital. Under the next PNP government, every operating theatre will be refurbished so that each patient instead of waiting years for their surgery. I mean, I've seen in my constituency people waiting for years for a hernia operation, suffering pain. It's a terrible thing, man. They will be able to have their procedures done quickly in well-equipped modern facilities. We will move from the cutting of ribbons today to the cutting of hernias tomorrow. Mr. Speaker, emergency departments are severely overcrowded with patients who could be treated in urgent care facilities and sent home. I repeat, urgent care facilities and sent home. We will create urgent care centers island-wide where patients will have the option of not only seeing a doctor, but having the relevant tests available for diagnosis and treatment. This, along with the expansion of emergency rooms and wards, will lead to shorter waiting times and end patients having to sleep on benches and floors once and for all. We need to end the indignity that people who need public health care in Jamaica are facing. The country is witnessing healthcare workers at all levels, from support staff to, for the first time in our history, medical consultants, taking industrial action due to poor working conditions, inadequate compensation, and mounting frustration with the system's deficiencies. And you can imagine working in the work environment that I've been describing, how that must be in terms of demoralization. Proper health care cannot be delivered by demoralized staff. The next PNP government will prioritize service delivery over options and gimmicks. We will service delivery over optics and gimmicks. We will ensure that staff are motivated, trained, and retained in the system through incentives such as sponsorships for advanced training, housing provisions, and adequate compensation, which is a goal that all of us have. The current government's approach to outsourcing diagnostic services instead of investing in hospital equipment has resulted in the accumulation of significant debt to private contractors in the health system. This causes service suspensions, because they're not getting the money, which force patients to pay for private services, which they can't afford. We will prioritize the presence of functional radiology equipment in every parish hospital and put an end to hospital patients waiting on ambulances to take them elsewhere for urgent scans. We will ensure that every parish has a CT scan machine. And I would add, the Children's Hospital which is currently without a CT scan machine, or a working one anyway. Yes, a child in my constituency had to be taken from Children's to KPH because there's no CT scan at Children's to do it, and ended up unfortunately passing. Mr. Speaker, the current administration seems to be averse to maintenance, whether it be roads or hospital equipment. Non-functional equipment is testament to their lack of attention to preventive maintenance. Broken and non-functional ventilators, ambulances, diagnostic equipment, even air conditioning units are usually the reason why critical services are not delivered. Simple things like that. Preventive maintenance is needed to prevent us from ever getting back to this situation again. Regular maintenance of standardized equipment will be a key priority for the next PNP administration. We will strengthen the health facilities maintenance unit through proper staffing and resources. Mr. Speaker, we recognize that there is little consideration for the immense value of volunteers who contribute in the health sector.